Hello! We would like to introduce our team coming from the ZeroCovid campaign in Germany, Austria and Switzerland. The ZeroCovid campaign started in January 2021 to advocate for an elimination strategy for the COVID-19 pandemic. Especially during the second and the third wave, we advocated for a comprehensive shutdown, including non-essential workplaces, to bring down case numbers as quickly as possible and to save as many lives as possible. A shutdown based on solidarity and oriented at society as a whole to combat the pandemic was our response to policies solely oriented towards keeping industry and businesses running as usual, without a long-term strategy or perspective.
In a shutdown based on solidarity, no one should be left behind, and the health sector must be extended and accessible to all people. We are concerned with the so-called care sector, both paid work in the public sphere as well as paid and unpaid work in the household. For the public sector, we demand better working conditions for the healthcare workers.
Concerning the private sphere, we discussed how in a shutdown based on solidarity, different problems could be dealt with. The problem of mental health, social issues like the division of labor in the domestic sphere, and domestic violence. These problems are aggravated as a consequence of the flatten the curve policy, which does not eliminate the virus, but leads to repeated and prolonged lockdowns.
Socially marginalized people, migrants, disabled people, queers, women, and those that are now often described as essential workers are disproportionately affected both by the pandemic and by the measures taken to control the pandemic. We strive to highlight these imbalances and stress the need for solidarity with those that are particularly at risk due to their living conditions, their workplace situation, or health conditions.
We are convinced that the virus can only be controlled if we take into account the global dimension of this effort. Poor countries need relief in order to be able to implement pandemic control measures, and they need access to pharmaceuticals and to the underlying, often patented technologies. Industrial policies that promote competitiveness rather than solving global problems restrict global production capacities. Failed epidemic strategies lead to the buying up of vaccines by rich countries. Right now, we advocate for the urgent donation of vaccines to countries where they could most effectively save lives, and for the patent waiver in the WTO. In the mid and long-term perspective, it will be especially crucial to transfer mRNA vaccine technology through the WHO and to establish regional production infrastructure throughout the world.
From the start, we sought to mobilize at the workplace and to communicate with trade unions to advocate for radical measures at the workplace, including shutdown of production instead of having restrictions being imposed on our private lives only. The value of life must be placed before profits. Likewise, we fight for taxation of wealth and corporate profits, including of those who have profited from the pandemic to help heal the damage the pandemic has inflicted on society.
So that's us, and we're looking forward to meeting you and working together to end the pandemic.